Hi, my name is Heath Van Wy. This is my focused anesthesia assessment for A&E 600. So with my patients, after I get to meet them, I establish rapport with them, and I do a neurologic exam, then I'm going to proceed with my focused anesthesia assessment. So for this assessment, I'm mainly focusing on airway, lungs, heart, and circulation. So first thing that I'm going to assess is the airway. So for my patient here, I'm going to just have you open your mouth and stick out your tongue. So for this patient, I'm taking a look in his mouth. I'm assessing his lips. I don't see any cyanosis on them. I can take a look at his teeth. He doesn't have any dentures or any removable parts that would get in the way if I'm going to establish an airway. I can see his tonsils, his gums, the mucosa, the soft palate. Everything looks normal here. So after I do that, I'm going to assess his TMJ. So I'm just feeling it right now. I don't feel any subluxation. It's equal bilateral, no abnormalities. I'm going to have you open your mouth and close it. Do you feel any tenderness when you do that?
Mm-mm.
Okay, so I don't feel any clicks. There's no crepitus, nothing to worry about there. So I'm going to have you open your mouth, and can you stick your tongue out? Stick your tongue up towards your nose, to the left and to the right. Okay, so that's all good. Next I'm going to assess his Mallampati score. So can you open your mouth, stick your tongue out, say ah, ah. Okay, so I have a clear view of his soft and hard palate and of his tonsils. I would consider this a grade 1 Mallampati score, which is good to see. Next, I'm going to measure his thyromental distance. So if you could just tilt your chin all the way back, I'm going to measure from the bottom of his chin to the tip of his thyroid cartilage. To get a good measurement, I would use a ruler, but my fingers are about 7 centimeters, so I would say the distance of his thyromental distance is probably about 8 centimeters for this patient, which is good. So I'm done with my airway assessment. Now I'm going to move on to the posterior chest assessment. So if the patient was wearing a gown, I could be able to take a look at his skin. I would take a look at it, make sure that it's nice and pink, there's no cyanosis. I could feel for temperature. His is nice and warm, nothing to worry about. Moisture, to make sure that he's not dehydrated. I could check turgor, to see if there's no tenting. Look for any bruising, scars, or any birth deformities. So next, I'm just going to watch him breathe normally for a little bit, look for any signs of respiratory distress. So I don't see him using any accessory muscles. He's not in tripod positioning, not breathing fast, and there's no cyanosis. So I'm going to have you just take a nice deep breath in and out. Good. So this looks symmetrical. I don't see any differences from side to side. I'm going to palpate for the chest expansion, feel that it's normal. Next, I'm going to palpate for tactile fremitus. So I'm going to have you say 99.
99.
Again.
99.
And one more time.
99.
Good. So I feel slight vibration when he says that. If it were increased vibration, it would be an abnormal sign, or if it was decreased, it would be a sign of like a mass or consolidation. Next, I'm going to percuss in his intercostal spaces in all the regions of the lungs. So I'm going to start up here. Just going from side to side, left to right. So when I percuss on him, it feels nice and resonant, which is a normal finding, which is good to see. So next, I'm going to listen to his posterior lungs. Take a nice deep breath in and out. Again. Again. One more time. Good. So I've listened from both sides as well as the lateral lungs, and I hear clear breath sounds bilateral, no abnormalities. Next, I'm going to assess egophony. So for this test, I'm going to have the patient say an elongated E. So when you feel my stethoscope on your back, just say like an elongated E, and I'll tell you what I'm listening for.
E.
Good. Again.
E. 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 E.
One more time.
E.
Good. So when he does that, I can hear a muffled E sound. If I were to hear like an A sounding, that would be a sign of consolidation. Next, I'm going to listen for bronchophony. So when you feel my stethoscope on your back, could you just say 99?
99. 99. 99. 99. 99. 99.
Good. So once again, I can hear a muffled 99, which is good to see. Next, we're going to assess the whispered pectoriliquy test. So I'll just have you whisper Scooby-Doo.
Scooby-Doo. Scooby-Doo. Scooby-Doo. Scooby-Doo. Scooby-Doo.
One more time.
Scooby-Doo.
Good. So when he does that, I don't hear anything in my stethoscope. If I were to hear like the phrase Scooby-Doo, it would be a sign of consolidation. Next, I'm going to move on to my anterior chest assessment, so you can sit back in the chair here. So first, before we get started, if he's in a gown, I'm going to take a look at his skin. I'm just going to look at the color, moisture, texture, look for any edema or any scars or bruising bilateral. This patient, I don't see any of that on, so I'm going to go ahead and palpate for tactile firmitis. So I'm going to use the ulnar surface of my hands, and I'm just going to have the patient say 99.
99. 99. 99.
Good. And one more time.
99.
Okay, good. So I feel some slight vibration on that, which is good to see. Next, I'm going to listen to breath sounds bilateral. Good. One more time. All right, good. So I can hear clear breath sounds bilateral. Next, I'm gonna also do the egophony and bronchophony on the anterior chest. So I'm gonna have you just say 99.
99.
Good.
99. 99. 99.
Good. Now I'm gonna do it with my stethoscope.
99. 99. 99. 99. 99. 99.
Okay. Now could you just say E?
E. 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 E.
All right. So now could you just whisper Scooby-Doo again?
Scooby-Doo. 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 Scooby-Doo.
Okay. So now that I've done that, I'm gonna move on to my heart assessment. So first, I'm gonna listen with the diaphragm of my stethoscope. I'm gonna listen to the aortic valve. Listen to the pulmonic valve. Listen to Erb's point. Listen to the tricuspid valve. And then listen to the mitral valve. So now I'm at the apex of the heart, so I'm going to listen to this for a bit here. So with the diaphragm of my stethoscope, I can hear S1, S2, which is a sign of sinus rhythm, and for his heart rate, it's 72 beats per minute. Now I'm going to listen with the bell of my stethoscope to the same valves. Good. So I don't hear anything different with the bell of my stethoscope either. Now I'm going to palpate the point of maximal impulse, which is right at the apex of the heart. So I can feel his heart beating, but I don't feel any jumps, nothing abnormal. Next, I'm going to move on. I'm going to have the patient lie down. So I'm going to again listen to all the same valves of the heart. I don't hear anything different when the patient's lying down. Now I'm gonna just inspect his chest for any heaves or lifts. So upon palpation, I don't feel any of those. I'm gonna palpate all the same valves of the heart for any thrills. And there are none present. So now I'm gonna have the patient sit back down, kind of in a semi-Fowler's position, and just take a look at his neck for any signs of jugular vein distension. And I don't feel or see any jugular vein distension. Now I'm done with my heart assessment. I'm gonna move on to the extremities. So first, for his upper extremities, I can take a look at them. I'm looking at the color, temperature, moisture, looking for any scars or bruises, which I don't see any. His skin is nice and pink, signs of good perfusion. I'm gonna palpate his radial pulses here. Pulses are 2+, and it matches up with what I heard with my stethoscope on his heart. I'm gonna check his capillary refill. Just press down on his nail beds, and the color returns in less than 3 seconds, so that's good to see. I'm gonna look at his lower extremities. I see some minor scabbing on his right lower extremity, but other than that, it looks nice and pink. It looks like he has good moisture, no signs of dehydration. Then I'm gonna palpate his dorsalis pedis pulses. As well as his posterior tibial pulses. Which are both good. Pull off the socks, see if we can check cap refill. So press down on his nail beds, and the color returns in less than 3 seconds. And that is the conclusion of my assessment.